Gotcha.
Welcome, Dr. Josh Levitt, to the Biohacker Babes. Thanks for joining us today.
It is my pleasure. This is fun. I hope that we can have a good conversation that inspires people out there today. I know you got a lot of listeners, and I'm looking forward to hanging out with them.
Yeah, we already had so much fun before we hit record, so we're just gonna continue.
Yeah, in the green room, right? The green room.
In the green room. Yeah, I can already feel the energy coming through the camera, so this is going to be a good one.
Yeah, it's going to be fun.
Yeah, well, we're excited to have you on. I mean, you have some amazing experience. You've been working with patients for over 20 years, and Lauren and I have heard you speak on, multiple platforms, and we're just really impressed by your approach. I would say you kind of like take the best of all the different medicines available and say, like, what's going to work best for this patient, right? It's not going to be the same thing for everyone. And you're doing a lot with very like chronic, common health issues, and a lot with like the pain and musculoskeletal conditions, which I don't know, this is kind of ironic timing. Just in the past week, I've had 3 friends tell me they're having like debilitating back pain, like out of nowhere. And I'm like, oh my gosh, this is like perfect timing. So we're definitely going to get into like the pain and inflammation piece and what's going on there. But I think just to start with the basics, because you are a naturopathic doctor, we've had a few on the podcast, but we've never really explained like what that is and what that approach to medicine looks like. So maybe you can kick us off there. What is naturopathic medicine?
Yeah, and I have to put a caveat before I answer it, because I can answer what naturopathic medicine is to me, right? In the same way that every patient is different, right? Every naturopathic doctor is somewhat different too. We all go through somewhat similar training, and my route. And you said that I try to make the best of both worlds, or use the best of both worlds. It's totally true. So like, just a very quick history here. Like, I am a naturopathic doctor who got his interest in all this, lit the fire, so to speak, on the day that I like desperately needed antibiotics. Otherwise I was maybe going to lose my leg. So the short story there is like, I was a pre-medical student at UCLA studying neurophysiology and getting a lot of like discouragement from conventional doctors about medicine, right? The conventional medical route was like turning into like this insurance dominated, pharma dominated medical industrial complex that just like wasn't as awesome as it used to be for these older doctors that my dad at UCLA at the time was introducing me to. And so I took a year off, traveled around the world. And during that time I got cellulitis, which is a terrible infection. I was like living out of a backpack and sleeping on beaches, that sort of thing. And so I got an infected blister on my toe, and it was like a terrible raging cellulitis infection that was crawling up my calf. I was in Switzerland at the time, and I wound up getting a prescription for antibiotics called into this Swiss pharmacy. And in there, I took the antibiotics. It was Keflex, which cured the infection. That was great. But in a Swiss pharmacy, very different than a United States pharmacy, there's like all herbal stuff, nutritional stuff, homeopathic medicines. And so here I am like needing like the orange bottle, with the white cap, the antibiotics, but then also getting exposed to this whole new thing that was just so intriguing to me at the time. And so that is like, it's kind of a funny irony, that like, and it carries through to this day that like antibiotics are sometimes necessary, like the case that I had and many cases I've seen since, but lots of times those other natural medicines, herbal, nutritional, and otherwise, can be very, very useful. And so, yeah, it's been 25 years since then, at least, and maybe more, maybe closer to 30. And that is still the passion. That's still where I'm at. And so that's really what naturopathic medicine is to me, is like using the best medicine for that person at that time. It's really not that alternative, I don't think.
Yeah, very cool. Yeah. I have 2 questions. I'm going to tell you the second question first.
All right.
No, I'm going to tell you the first question first, because it's just distracting me. You said naturopathic, and I've heard that a million times. Renee and I, more easily rolls off the tongue naturopathic, because I thought it was based on, is this a tomato argument, or is there really a correct way?
That is so funny that you ask. I've actually never been asked that. I've been on a lot of different podcasts and stuff, and it's great. Like, this is the first time I've ever really been asked that question in a public forum. There was a meeting back in the late 1980s, early 1990s of the powers that be in naturopathic medicine, which is the American Association of Naturopathic Physicians, which was a young organization at the time. And they've debated this question. And the answer that they came up with is the way that I say it, with the hard A, naturopathic. And so that's the way I continue to say it, because I had mentors in the field that were like older doctors, senior doctors, that taught me the way, so to speak. And if I may, can I just like throw in like a little bit of like political or kind of cultural information around this question?
Oh yeah, because then
Go
no
for
one
it.
will ever forget the answer.
Yeah. So I say naturopathic, and I talked about the American Association of Naturopathic Physicians, which is the sort of the governing body nationally, and that's where doctors like myself who've graduated from accredited universities like Bastyr University in Seattle, there's several other ones in throughout the country that people can look up, who pass a board certification exam and are licensed by their various states. So in the United States, I don't know the exact numbers, but there's only about half of the states that recognize the kind of license that I have as a naturopathic doctor. I'm in Connecticut right now, and my state happens to be one of them. And that's why I have a license that's from the Department of Public Health. And we can take insurance at my office, all the regular stuff, doctor stuff, there are other states, including one right next to me, which is New York, that do not recognize the license of a naturopathic doctor, no matter what. And what that means is that those letters after my name, I use the credential ND, naturopathic doctor. So those letters mean nothing to anybody in politics in the state of New York. It's meaningless. And that means that anybody can use those letters. It doesn't mean anything. There's no governing board. There's no body that regulates the practice. And so there you have a problem, right? You have naturopathic doctors that have gone through the rigorous training that I went through. And then you have other people who call themselves naturopaths. Often they use the soft A, naturopaths or naturopathic doctors, who are well-meaning, often well-educated, but just different, right? They're differently regulated, they're differently trained and educated. And it's a PR problem. What can I say? I mean, so anyway, a lot of the people that say the naturopath with a hard A are trained in the way that I was. And anyway, I don't want to get too much into it. We could use a whole hour of our time. We have other more important things to talk about, but it's interesting. Yeah.
Yeah.
I mean, way to catch someone in a lie if they say naturopathic. I'm like, oh, heard you.
Where'd you go to school? Where'd you go to school? You want to hear the joke? I mean, this is so bad. I shouldn't even say this, but there's a little joke, like the behind the scenes joke of us, us like Ivory Tower, we were trained the good way, naturopathic doctors with the hard A. The other types, and again, well-intentioned, often do great work too. But they use the same letters ND after their names in these so-called unlicensed states. So we call them undies instead of NDs.
Low.
I know it's brutal. I shouldn't have said it.
Now everyone's gonna remember. Yeah.
But I love that.
It's just a little jab, Yeah.
That is fair. You worked really hard. I understand that you want to keep that in your realm. So totally fair. So I'm assuming the naturopathic is based off of the healing powers of nature, which are really, really important. But you also mentioned that antibiotics sometimes are also beneficial. So I assume as a naturopathic doctor, we have to use like an insane amount of critical thinking. And I think there's also a hierarchy of interventions. Can you explain that? And what really is your approach? Because there could inevitably be a million different ways to help a patient.
Totally. Yeah. These are great questions. So there is indeed a hierarchy of interventions. We call it a hierarchy of therapeutics. It sounds so fancy, kind of like a ladder, a stepwise approach. And let me give you a metaphor. I love metaphors. I think they work well for educating both patients and listeners and everybody. So here's the metaphor. Let's say that there's a fly buzzing around in your kitchen, okay? And it's buzzing around. That's our problem. We have a problem, and the problem is that there's a fly. So there are a bunch of different options here available to us that are solutions, right? Treatment plans, if you will. So I'm like kind of like a peace-loving kind of gentle human. And so my first approach is to try to get the fly out, like by opening the door or the window and see if I could get it out, right? That's one approach. And it's reasonably effective. It's pretty gentle. There's some risks, like another fly could come in or something, but that's like a low rung therapy, right? Then up from there, it's a metaphor too. I sometimes do swat flies, but the next rung up from that might be to swing at it with a newspaper or a fly swatter, right? A little bit more of an invasive or toxic, if you will, intervention, certainly to the fly. Then up from there, we could get Raid or some of these chemicals and spray it around the kitchen. That's an increasing level of power and effectiveness, right? But also leaves side effects because you don't want that stuff all in your kitchen. And then up from there, we could pull out like a blowtorch, right? And just torch the place. It'd be very effective, but very toxic. And so like the idea there is that I just described a hierarchy, like a ladder, a stepwise approach. And in my world with a patient, I look at the problem. It's usually not a fly in the kitchen, but some kind of medical problem, and then look at the array of options that are available to me and try to pick the lowest one that meets the patient where they are, that will accomplish the desired result with the least amount of force and the least amount of toxicity, and then just pick from there. And sometimes it means taking step one, that didn't work, take step two, up from there, and that's the way I think of the hierarchy of therapeutics in naturopathic medicine. And yeah, surgery, antibiotics, they're all on there. They're all up there on those higher rungs. And sometimes to reach those hard spots up there, you need to get up on the high rungs. I mean, that's just a reality. So
yeah, makes sense.
I got to tell you though, like, as I'm thinking about it, there's been many times in my career where I've encountered people who have very serious medical problems who are unwilling to go up on those higher rungs, right? They just absolutely won't. Like, they have extreme dogma. No way am I taking antibiotics. No way am I getting surgery. No way am I doing that. And I've seen, I mean, we don't need to get into it, but I've seen tragic outcomes as a result of that kind of dogma many times in my career. And that's really reinforced the idea that, yeah, sometimes you need to get on the upper rungs. It's not worth losing your life over, usually. So, yeah.
Right. Yeah. Yeah. And actually our dad has been a biological dentist for over 40 years. And I've heard similar stories from him. Like, his patients are very, very holistic, biological medicine focused. And they might have like, an abscess. And they're like, I don't want to do antibiotics. But even our dad might be like, okay, maybe antibiotics right now, because it's literally going to save your life. And then let's get the tooth out. Let's clean it out. Let's look at, the rest of the body and the immune system. But is it really worth like losing your life over one round of antibiotics? Right. So yeah, I think we have to meet in the middle there.
Totally. I totally agree. And you mentioned musculoskeletal pain. This happens all the time with surgery. People don't want surgery. They don't want a joint replaced, and it's this is the thing that's crazy about this, right? That, like, I talk about this all the time, that there's hundreds of thousands of unnecessary surgeries that are done every year in the United States. Like, it's just amazing. It's a massive problem. Like, it's a tragedy that orthopedic surgeons replace joints that don't need to be replaced, or do arthroscopic surgery on people. And we can talk more in detail about that, but it's a huge problem. And when I talk about unnecessary surgeries, there's like voices out there on both sides of the equation. One set of voices is like, yeah, doc, unnecessary surgery, Western medicine is bad. They just want the money, all that kind of stuff, right? That side. And then other people are like, are you kidding me? My knee surgery, my hip replacement, whatever, is the best thing I ever did in my life. Like, I couldn't play tennis. Now I can. I couldn't walk. Now I can. And what I'm trying to say is both of those things can be true. There can be very unnecessary surgeries done, at massive levels, really a problem. And surgery can be totally awesome. It can be both of those things. And it turns out that they both are true.
Yeah.
Are you a Libra? I love this.
No, I'm a Virgo. That's
scales.
a good. I'm a Virgo.
Yeah. Because I'm a Libra, and that definitely is like how I think about everything. And I'm one of those cases where when I was 13, my orthopedic surgeon wanted to fuse my spine. And because I had 2 stress fractures and 3 herniated discs. And I didn't go that route, but I had to do a lot of work, like chiropractic and acupuncture, massage, PT, nutrition, like you name it. I had to do all the things. And I think I'm a success story from that angle. But yeah, there's other people that have done the surgery and are so happy. So
right. And
love that approach.
It brings up another thing too, which is like the disparity in America, right? Like, a lot of those other things that you just talked about cost money, right? And like aren't covered by insurance. And so there's lots of people out there that are like, I want to do all the natural whatever, right? The chiropractic, the acupuncture, the PT, all this sort of stuff, but it's not covered, and the surgery is. And so like, what am I left with, right? Like, that's, I mean, now we're getting into like healthcare in America, it's a thing.
That's a really good point. I actually ironically, I didn't really think about that, but I guess, I had the luxury of, our parents could pay for the alternative stuff. Cause none of that back then, especially 25 years ago, wasn't covered by insurance.
Right.
So
Right. Yeah.
So
grateful. And that's
grateful.
Yeah.
How much of the unnecessary surgeries do you think are due to that? People just choosing that because it's the slightly easier or accessible option versus maybe you can give us some other reasons why that would happen.
Yeah, that's a really good question. I mean, I do think that there are some people who have been who don't even know that listen, I think the vast majority of these unnecessary surgeries are happening to people that do not know, or just are simply not aware that there's another option, right? And the reason why is because, and you want to talk about that now? I mean, we may as well get into it, right?
We're here. Let's do it.
Yeah. So you mentioned a few people that have had back pain, right? And you yourself even had herniated discs. So let's talk about that, because that's like it's the number one reason for visits to orthopedic doctors, maybe even family care doctors in the United States. Back pain is a massive problem. And the usual routine is that somebody has back pain, and then if it doesn't go away, or if it's not getting better in a timely fashion, which it usually does, they'll then get imaging, right? They'll get x-rays and or an MRI. And very often that MRI will show something, and that something is usually a herniated disc, right? Or a bulging disc. And so when a patient has pain and has a bulging disc, there's this obvious logic trap that people fall into, which is that the pain must be caused by the abnormality we saw in the MRI, right? It just makes sense. Like, oh, you have pain. Look at that. We found a bulging disc in your back. Those two things must be connected to each other, right? The bulging disc must be the cause of the pain, which then leads to a whole bunch of interventions, right? Like we can do a steroid shot, we can do surgery, right? Usually a microdiscectomy or a laminectomy or a fusion. And here's the problem with that, is that if you look at MRIs of people who do not have back pain, and this has been done many times, we have lots and lots of data on this. Let's take 40-year-olds, right? People who are between 40 and 50. 40% of 40-year-olds who have no back pain have disc herniations on their MRI. 50-year-olds, 50%. 60-year-olds, 60%, and so on. I'm going to reiterate that. These are people who do not have pain. They also have disc herniations. So there's massive amounts of the population who have asymptomatic backs. They feel good, but they have disc herniations. And so all of a sudden, if you become a person who has pain for whatever reason, and you are one of those people who has a disc that's bulging, all of a sudden your disc is the reason for your pain. And it's just not true. In many cases, it's just not true. And yet it leads to all these unnecessary surgeries. So that's kind of what we're talking about here.
I would perhaps
Wild.
fall into that category. I'm not completely asymptomatic, but I do know I have a slight disc herniation, and I have some pain sometimes, but if I do all the things that I know to do,
Right.
it's very well managed, and I effectively don't have pain, but I have access to a lot of things. I'm very lucky and grateful. I can imagine how quickly that can spiral, because pain just overtakes your brain, depresses your mood, your motivation. I'm sure you see this. People spiral. So what else can we do?
Your case is a case in point, right? Are there times when you have no pain? Does your back sometimes feel good?
Sometimes I notice nothing. I feel amazing.
Right. So we should talk about it a little bit more, because those times when you notice nothing, like when you're like in a good yoga groove, or like on vacation, or on a nice walk, or whatever it is, whatever those things are, like eating well, doing all the right things.
Ironically, it's when I do a lot of strength training that I feel really good. Like lifting heavy, I feel the best.
Awesome. Yeah. So we should talk about this even more detail. But let me tell you, if you're feeling great, strength training or otherwise, right, whatever the reason is, you still have that disc herniation. I hate to tell you, it's there.
Yeah.
So like that should be like, I don't think you have to be like a super smart person to understand that if your back doesn't hurt and you have a disc herniation that's visible, then it's not the disc herniation that's making your back hurt. It's got to be something else, right? It has to be, because the disc herniation is there all the time. If your back doesn't hurt when you're doing strength training, then it ain't the disc that's causing your pain. That's my story. Well, we could talk more specifically. Yeah.
Yeah.
So what are the other reasons for the pain? Or let's say the signal to the brain that signals that there's something wrong.
Yeah, which is the obvious next question, right? So like, if the disc herniation is not what's doing it, then what is it, right? And I want to be clear here. A disc herniation is not normal, right? It's not good. It's not a great thing, but it's just, all it is a vulnerability, like so many other things. It's part of the story, but not the whole story. So what are the other parts? I'd say there's four other main parts. One of them is excessive inflammation, not just inflammation because plain inflammation, but excessive, more than there should be given the stimulus. So that's number one. And it's very common because so many people eat badly, and there's all kinds of reasons. We can talk more in detail sometime about the reasons for excessive inflammation, but that's number one. Number two is about muscle tension. and or muscle strength versus flexibility ratios, right? The biomechanics of musculature and how that fits in. Your experience speaks to this as a major factor. When you're doing a lot of strength training, those muscles are strong and supportive, and they're doing a great job of supporting that vulnerable spine, and then that spine feels good. When those muscles are a little bit weaker, that spine's not as stable, and you're more prone probably to muscle spasms to try to stabilize it, or actual instability that causes pain. So muscle tension or strength to flexibility ratio imbalances in the musculature adjacent to the problem is number 2. Number 3 is something a lot of people don't know about, and it's called fibrosis. And what fibrosis is scar tissue. Fibrin is what scars are made out of. It's a kind of a tangled mess rather than the nice linear fibers of a muscle or the tissue that it replaces. And fibrin can accumulate on microscopic levels from chronic inflammation or repetitive strain, or on macroscopic levels from like old injuries, big scars from old surgeries, old injuries. Part of the reason why people who've damaged a knee or a hip or had a big injury earlier in their life wind up having degenerative changes later. So fibrosis is number 3. And then number 4 is like totally different than any of those. Number 4 is about the emotions and the stories and the psychology and all of our own personal history and our family history, what we've seen, what we've experienced, and how that informs our experience of pain. And many people are telling themselves all kinds of stories about what this pain means and what it is and what it's going to do to them. And I would say that changing the ending of those stories is a big part of the treatment plan for a lot of people too. So those are my 4.
Yeah, I just have to
wow.
interject because I had a conversation with a PT friend of mine that was like, pain doesn't exist. I was like, okay, we gotta have to go deeper into this because pain means something. But if you think about pain, is pain really harming you? Like, what's the worst that could happen in a lot of situations? And if you can reframe your relationship to pain, then the signals may actually change. And that certainly has happened with me. I literally meditated on the idea of pain, and the pain was reduced.
Yeah.
So
yeah, you get
that
it.
is like, I really get it. That's really valuable. And then also the muscular tension. When I stand at my standing desk for too long, I tend to tighten my hamstrings, and that immediately hurts my back.
Mm-hmm.
And, most people think, oh, a standing desk is really healthy for you, but could be perpetuating an imbalance. So I'm like, the things you listed, yes, yes, yes.
Yeah, totally right. And the pain piece is so interesting, right? Like it is, we know of phantom limb pain in people who are amputees. You've probably heard of that. It's a crazy phenomenon. You lose a leg or lose a foot, but it still hurts. That toe itches or hurts. Like obviously the pain isn't in the limb, right? Because those people don't even have a limb, and so it's in your brain, and it's informed, by stories that we tell ourselves. And most of the pains, especially the orthopedic ones, they're not dangerous. They just hurt. It's like the signal of pain. I think of it like fire, right? If you put your hand too close to a fire, you get pain, and that pain initiates a behavior change. It's like, all right, I better move my hand away from this fire, because if I don't, things are going to get bad. It's going to burn. I'm going to have a problem. And that's what pain is about. But in many cases, these orthopedic or musculoskeletal pains, they're not dangerous. And so a lot of people can meditate on a mantra, something like what I just said. It's not dangerous. It just hurts. And that can really, really help people. Changing the story that they tell themselves about the pain.
Yeah.
Yeah.
Like that.
Wow. The 4, this is really going to stick with me. I think this is such an interesting list. And I will say on the emotional piece, I love that you're bringing that in, like the mind-body connection. I think not enough people are talking about that, especially when it comes to pain. But again, circling back to my back pain, the 2 worst episodes I had was when our grandfather passed away, and then one of my really close friends passed away.
Mm-hmm.
I mean, like couldn't walk pain.
Yeah.
And then as the emotional trauma resolved, the back pain started to get better. But again, I could have just had it fused and, whatever. But so I would love to break down the 4 a little bit more. So the inflammation. So how does someone know if excessive inflammation is the problem? And then if it is, what do we do about it? Do you start with nutrition?
Yeah. So like I said on that hierarchy before, excessive, we start wherever is the right place to start. Right. And so meet somebody where they are. And I know a lot of your listeners are already pretty far along on this route, like already taking good care of themselves and eating well, hopefully, whatever that means for them. But yeah, so let's talk about excessive inflammation and break it down. First of all, inflammation is a biologic, physiologic necessity, right? We need it. It's how we respond to infections, how we respond to injuries. You can't just make inflammation go away. Like eradicating inflammation is not the goal. It's just to control it, much like fire, which, by the way, inflammation is named after. Inflammo, it means to set ablaze in Latin. It's named after fire. And just like fire, right? Like if it's out of control, it's devastating. If it's in control, it's great, cook with it, candlelit dinner, whatever, right? And so that's what we want to do with inflammation. And the way you control inflammation starts, like the lowest rung of the ladder, with what you eat and what you don't eat, I suppose. But controlling inflammation is about eating minimally processed, close to the earth foods that are in their natural form. I don't think we're going to get into a whole detailed dietary analysis, nutrition here, but like an anti-inflammatory diet. I think you and your listeners know what that means. And that's the lowest rung. And that's also the rung where most people get wrong, right? Most people, especially the ones who come and see me, they're not eating right. And they have more inflammation than they should. The campfire has escaped the fire pit and it's burning down the campground, and we got to get that diet under control if they're willing or able to do it, right? So that's the place to start for sure. And then
do you see a lot of, just curious, do you see a lot of leaky gut? Because once we kind of disrupt that gut lining, most things could be inflammatory, right? We could be eating a healthy diet, but things are just crossing in and out of the gut. Is that a big problem when we're talking about like eating well?
Yeah, 100%. I mean, many of the people who haven't eaten well for a long period of time or have had other indiscretions or even problems that, that weren't even their own doing, have intestinal permeability issues, which then, provoke a more aggressive inflammatory response, even to foods that would otherwise be healthy, right? And so this is probably what explains, how we demonize a new set of foods every so often. There's another author that comes out and now you can't eat nightshades, now you can't eat gluten, and dairy is the problem, and on and on and on like that, a never-ending list of inflammatory foods, which for most people aren't inflammatory. It's that intestinal permeability problem that makes, in many cases, otherwise healthful compounds provocative to people. So absolutely. And gut repair, assessing or diagnosing that intestinal permeability problem and then taking steps to correct it is a really important part, and probably like maybe the next rung up on the anti-inflammatory naturopathic protocol.
Excellent. And then what about bringing compounds in that would be anti-inflammatory? Or I'm curious, do you use diagnostic testing to determine if I know it's not a lot of like great cytokine testing, but something just as simple as systemic inflammation. Is that helpful?
Yeah, totally. I mean,
CRP?
I do testing, and testing can be useful. I mean, it's funny, right? You say like, there's tests for general inflammation, like ESR, it's called a sedimentation rate, or a CRP. And these things just check inflammation. In like medical residency, people will say like, what does a elevated ESR tell you? And the answer will be that the laboratory is open, right? Like that they did a test. It doesn't mean anything. It just means like, it's like, it could be anywhere. You could have gotten stung by a bee, you could have rheumatoid arthritis, and you could have elevated SED rate. So it's not helpful in terms of laser pointing at a diagnosis, but it can be helpful, especially in the diagnosis or the workup of autoimmunity. You're right that like cytokine testing, we can go nuts with like very expensive functional diagnostic laboratory tests. But if those tests are going to lead me down a road to tell a person that they should eat better, that they should fix up their gut, that they should sleep better, they should, do all these foundational things, then I don't think I really need that test. So especially if it's going to cost a patient a lot of money, I'm just going to like stick with the basics and try to convince them that like, I don't need a test. I think we know what's going on here.
Yeah. Yeah. I mean, like I'm a big fan of using the GI map stool test, but same thing. I'm like, if someone has like all these gut issues and they haven't even done like a basic 4R protocol or something like that, then it's like, save your $450 or whatever. And just, let's just at least try. Yeah.
Totally.
There's so much to try first.
And I'm not down on those tests at all. I'm really not. I have noticed, it's like an interesting thing over the course of my career, which is, decades long now, that like I was much more enthusiastic about functional or integrative laboratory testing earlier in my career, where I felt like I had some hints in my mind, and then I used those laboratory tests to validate my my concerns or to, to evaluate them. And then also to convince the patient that what I wanted them to do was right based on what we saw on this piece of paper. And then as time went on, I found like with more experience in clinical practice, it was just like, I don't feel like I need to spend your money on this. I already know what to tell you what to do, in many cases. Obviously, I ordered lots of labs and imaging, but like really to refine, and so, yeah, those tests certainly can be useful. I think a lot of times they're overused because the outcome is eat better, move more, sleep better, that kind of thing. So, so if a test can really make like a meaningful needle move or like help me decide, am I going to go this way or am I going to go this way? That's a test I want to see.
Right. Yeah. Right. I think some clients just have the money and they're like, I want to do everything.
Totally. And that's great.
Or people that need evidence. They're like, they're a disbeliever until.
Right. Gluten's fine until I show them their anti-gliadin IgA. They're like, oh, fine. All
and
right.
that's a perfectly appropriate use of those kinds of tests, is to convince somebody like, hey, look on the paper. It says it right here. Absolutely. Some people just won't believe it until they see it printed that way. Absolutely.
Yeah.
Yeah. So what are your favorite compounds for inflammation?
It's a good question. So, and I don't want to do a sales pitch here, but I've been after this for a long time, right? And so like there's been many years of trial and error in my office, dealing with people, trying to figure out like what's the solution to treat, like to manage that excessive inflammation, that muscle tension, that fibrosis that leads so many people to pain. And so I'll tell you what I've hit on, as the recipe, the secret sauce, so to speak, and I'll go through the list of my top ingredients. Number one is something that I know is familiar to you and probably to a lot of your listeners, which is curcumin, the most bioactive compound inside of turmeric. Turmeric only contains about 2% curcumin. So curcumin's more, it's very potent anti-inflammatory, but it needs to be concentrated to really get that kind of, I almost said pharmaceutical effect, but that really powerful effect, right? And so I'm a big fan of high potency curcumin. I use a proprietary extract called BCM 95 curcumin, which is my favorite. It's got a lot of clinical studies on it, and it just works great. So that I'd put that at number one. Number two is Boswellia. Boswellia serrata is the gum resin from a tree that is commonly known as frankincense, and it also has potent anti-inflammatory activities, and even some studies with electron microscopy of sort of resurfacing, if you will, filling in the pits and gaps and smoothing out the surfaces, cartilaginous surfaces and joints. So Boswellia or frankincense is number two. Should I keep going?
Yeah. Love
All
this
right.
list. Love it so far.
Number three is bromelain. Bromelain is a digestive enzyme, actually a proteolytic enzyme. Oh, here's an interesting thing about bromelain. It's an enzyme that comes from pineapple. It's concentrated in the core and in the stem of pineapple. And it's also the active ingredient in meat tenderizer. So if you ever buy meat and it's tough and you get like from the store, like a little can of meat tenderizer, from McCormick Company or whatever, meat tenderizer is bromelain. That's what it is. And when you sprinkle that meat tenderizer on your steak that's too tough or whatever, it'll break up the fibrin. It's fibrinolytic. It breaks up fibrin. And it turns out that you can eat bromelain, put it in your mouth in a capsule, or even eat pineapple, and it will get absorbed intact into your bloodstream, and it will exert its fibrinolytic, its proteolytic fibrin breaking activity in your body. So that's why I use bromelain for that fibrin part. That's I think we're on number three. I did curcumin.
Yeah. I'm curious. Go ahead, Renee.
I was just gonna say, I know Ben Greenfield, he's put out like some recipes and cookbooks and stuff, and he will sprinkle proteolytic enzymes on his steak. Mm-hmm. I remember hearing that. Like he'll just open up the capsule, but that's funny that you could just buy that as a
totally.
meat tenderizer.
Meat tenderizer is way cheaper. Yeah.
Yeah.
I'm curious about the bromelain. So this is interesting. I was a Broadway performer for a while, and the Broadway community, bromelain really kind of caught fire. That's an interesting word that I just used. Yeah. For inflammation for the vocal passages. So if there was inflammation from singing, 2 shows a day could be quite demanding.
Yeah.
I wasn't really sure about the mechanism of action. I didn't know it worked on the fibrin. I wonder if that's actually doing what people were thinking it was doing.
Yeah, that's interesting. And I've had a number of people have come to me over the years with that problem, right? Like it's like preachers or singers, that kind of thing. And bromelain is it's certainly on the list of things I would have considered. I never heard of that story that it caught fire like that on Broadway. It has anti-inflammatory properties as well, right? So it's not just a proteolytic enzyme. It's not exactly clear the mechanism by which bromelain decreases inflammation or excessive inflammation, but it definitely does. And I wonder, the thing you hear about with a lot of performers, whether it's Morgan Wallen recently or Adele back in the day, like they get vocal cord polyps. Those vocal cords are really working hard. And I'm not an ENT, but I would be surprised if there's not a fibrin accumulation in those Broadway performers, those singers who are overusing their vocal cords, because it's a lot of vibration, a lot of activity there, inflammation, fibrosis. And I bet I would be surprised. I bet bromelain works in that situation. I bet it caught fire for a
everyone
reason.
was using it. They
Yeah.
kept doing it. I assumed it was probably a little more than placebo, but interesting.
Yeah, that is.
Cool.
Yeah.
So we got three now.
We did three. Yeah. The next one, number 4, I suppose, is an interesting bioflavonoid compound called quercetin, which is found in all sorts of different foods. It's in onions, it's in apples. It's a bioflavonoid compound that also has a broad spectrum anti-inflammatory activity. It targets many of those different cytokines. You mentioned those earlier. And there's one in particular I want to come back to called IL6 in a minute. But quercetin goes after a whole bunch of, that's a famous one. It goes after a bunch of those as well, and is a powerful antioxidant, and seems to be just kind of like something that brings this formula together in a way that just makes the total bigger than the sum of its parts. So quercetin is number 4, I think we were on. Number 5, I would put magnesium on the list, and that's to address the muscle tension piece, right? So many people are walking around magnesium deficient or insufficient. And I know you've talked about that before. You're well acquainted with it. It's a critical mineral for so many things, especially muscle tone. And there's lots of people who have an injury, maybe a little car accident or a little something. And also part of the reason why you mentioned during those stressful times when your back got bad, stress depletes magnesium. Stress uses up more magnesium because it's so heavily involved in the biochemistry of the stress response that you have more demand for magnesium when you're under stressful circumstances. And if you're already kind of teetering and you're not quite sufficient with magnesium, put a heavy stress on you, the magnesium gets depleted and your muscles lock up tight like that. And then your back hurts. Right. So
Makes
like
so
that
much sense. I wish I had known that back then.
Yeah, you should have called
magnesium.
me. So
do you think that topical magnesium for specifically back pain and doing an oral supplement as well? Well, I'm not sure if you're using topical at all or your thoughts on it.
I have you. So there's a few studies that have demonstrated that topical magnesium can get absorbed, and so increase levels in the bloodstream after topical administration. They're limited studies, right? So I'm not super convinced of the value, and I haven't seen it pay off as much as oral magnesium does. So usually what I'm talking about here is oral magnesium, administered as a supplement.
Right. And specific type of magnesium? Do you use like glycinate or?
Yeah, we're getting into it. So I like mag citrate is usually my first choice. And this is for the general population. I got to put a caveat here. This is in the general population. I like magnesium citrate. It's cheap. It's well absorbed. It's well tolerated by most people. And so it's my first choice. There are other choices. You mentioned glycinate, which is a great choice for people who don't tolerate citrate, because it can be a little bit hard on the GI tract. It loosens the stool. It has a laxative effect, which many people in the general population actually need and appreciate, right? They're constipated. Right. And so a little mag citrate not only helps their back muscles relax, but also helps them poop better. And so that's why I pick citrate for the general population. Yeah. If a person's already tending towards loose stool, then glycinate might be a better choice.
Mm-hmm. Great.
Excellent.
Makes sense. All right. We got 5.
So many
is that
good
your top
ones.
5?
Does the list go on?
Yeah, I got one more. And the one more is a little bit controversial sometimes. I know biohacker types, maybe you're going to push on me about this one, but the last one is piperine, which is a black pepper extract. And that one is really interesting because it enhances the absorption of everything else I just mentioned. The studies have mostly been done on curcumin, and piperine enhances the absorption of curcumin by orders of magnitude. It's like 2,000% better absorption. Curcumin's not super well absorbed, so getting it into the person is really important, and piperine really helps that. And it also helps the absorption of other things as well. So I often include, and in the formula that I've made, that has all these ingredients, there's a little bit of piperine in there as well. And I find that for the vast majority of people, the benefits outweigh the risks. And there are the risks. I say risks. Piperine doesn't really have a lot of risks. For some people, it irritates their stomach, and so those people shouldn't use it. But I think that the benefits outweigh the risks for the general population.
Is that the Biohacker Backlash? We like Piperine. I wasn't sure what you were going to say.
No. Well, I've had a few backlashes about it. Yeah, like
I know what you're
piperine.
talking about.
Yeah, people get they think it like makes intestinal permeability worse. It creates GI inflammation. Some people have told me that they don't like it because it's in the nightshade family, which it's not. It's not a Solanaceae family plant. It's a different genus. So yeah, I don't know. There's probably a biohacker out there somewhere that said something bad about piperine, and then the internet took over. So I think it's good stuff.
Exactly what happened. I know, I remember a specific biohacker that said, we no longer need this with our curcumin. This is fake news. And then it was just like, boom, 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 all over social media.
Yeah.
Like we were talking
and
about.
Usually what it is, right, is like someone saying we no longer need this because we have this new thing that's lipolyzed or nanonized or whatever, and it's better. And so they're, it's
what's
like
the agenda here?
Yeah. Like, is this marketing or is this medicine? And listen, like I'm a fan of both, as long as it's done with integrity.
That sounds like a podcast. Is it marketing or is it medicine? Sounds like you could start a podcast there.
We could start with making that the title of this one, because we did talk about that before we hit record in our green room, behind the scenes, about how things just overnight can be these internet sensations. And then suddenly, the public kind of gets distracted or bored or finds something else to talk about. And then there's a big uproar about something else.
Totally.
How do we sort through all of this kind of madness and studies that are released when, a lot of people will read titles of the papers, but they won't actually read the paper?
Yeah, it happens all the time. I mean, it seems like once a week there's another miracle compound, and then there's also some other demonic compound that will kill you, right? And like here we are now, and I think the fervor is quieting down. But berberine was like the darling recently, because it's a great compound. Berberine comes from these berberis family plants, and it's really great for blood sugar control and can be useful in helping people manage lipids. Very modestly useful for weight loss, but it got tagged on TikTok as nature's Ozempic, and then just blew up, right? Berberine's flying off the shelves. There's a massive media outcry about this. I'm getting calls for interviews from major media outlets about it, and usually just trying to say, it's again this balance thing. You were talking about Libra, maybe, it's like we were talking about unnecessary surgery, and surgery can be amazing, and both can be true. So with something like berberine, or another one that got popular recently, taurine, it's like it can be great stuff. It can be very useful in clinical practice for people, but it can also not be a fountain of youth. Like not everything has to be like absolutely useless or a total miracle. There is an in-between there. And many of these compounds that get headlines, viral TikToks or whatever about them, are the truth lies inside of the middle. It's not a fountain of youth, nor is it a waste of money, and that's basically what my career has become, is trying to kind of try to navigate that line there in the middle.
Yeah, deciphering it all.
But people don't like that. People are bored of the middle, right? That's not what excites people, right? People like the edges, That's where the stuff is, whether it's in politics or anywhere. It's like they like those outliers is what really is intriguing. And when you tell people to stay balanced, sleep well, eat well, move your body, they're just like, that's boring.
That sounds like a dopamine problem. Maybe there's something else going on.
Yeah, totally.
That's very true. Well, circling back to like the anti-inflammatory side of things, I think like someone with back pain on average would just take an aspirin or take an ibuprofen. But so again, here's that side. Yes, those can be helpful when we're like in excruciating pain and we have to get through a day. But then on the other hand, we have all these other amazing anti-inflammatory things we can do that we talked about. So how do we get people off of the the hard stuff, I would say.
Mm.
Like
The hard drugs.
hard stuff.
Yeah.
Yeah.
It's a great question. I think you've learned now I'm a fan of metaphors. And so the metaphor that I use when people ask me this, and this applies to the hard drugs for musculoskeletal pain, or really in many cases, other types of medicines that people use and they want to switch over to a more natural approach. My metaphor is that of a three-legged stool, or maybe a tripod in our world now. You know, I got my camera set up on a tripod. You probably got a couple of tripods around there too, right? Tripod, 3 legs, right? If you take one of those legs away, that thing's going to fall over, right? And so right now, a person who's using whatever drug it is to manage their back pain or manage their shoulder, their hip, whatever, that drug is one of the legs of their tripod, right? And they need it because it's holding them up. So we can't just take it away, because if we take it away, a 2-legged tripod doesn't work. And so what I do is I put in all kind of other legs, right? Like let's just add to the tripod. Let's add BCM 95 curcumin. Let's add some good movement. Let's add some strength training. Let's add some dietary changes, lifestyle modifications, get a new mattress, whatever, all kind of different legs, right? We got 4th leg, 5th leg, 6th leg, 10 legs, right? And then once that thing is stable and we're saying, all right, now your back's feeling pretty good, still on the whatever it is that you're taking that you're trying to avoid. Now let's look at this multi-pod that has many legs in there. It's much more stable and supportive. And we can now take that leg that you wanted to get rid of, and we can start to wiggle it out, right? We can take it off slowly. It depends on the drug. There's some nuance here, but we pull that leg out and see if all that other stuff that we put in there to stabilize it keeps it upright. So that's the way I do it. And many of the things that we talked about today are the legs of that new multi-legged tripod. That's how I do it.
I love that metaphor. I love it so much. Are there any contraindications to mixing these things if inherently the natural compounds are more supporting a healthy inflammatory cycle, whereas something like an NSAID is kind of cutting the cycle off?
Yeah, great question. And I'll do my best to answer it in a general way. The answer is yes. Like natural compounds, especially the ones that we talked about, there's no side effects to changing your mattress, or you can exercise, you can go for a walk, you can eat better. But when you're starting to get into the zone of powerful herbal medicines, just because they're natural doesn't mean they're completely without risk. And if a person is on pharmaceutical medications, especially medications that thin the blood, that's a thing that you really want to talk to someone who knows what they're doing about. And that would be a naturopathic doctor, even a conventional medical doctor, hopefully has access to a database where they can cross-check what you're taking or what you intend to take in the herbal medicine world with whatever pharmaceuticals you might be on, to make sure that that's not a problem. And blood thinning or anticoagulant drugs are notorious there, but there are some substances, certain drugs that people take. And again, it's too big of a conversation for now because it's all these individual drugs. There's hundreds of them, do need to be checked. Every now and then we run into a thing where somebody's taking a drug that's processed by the liver, certain pathway in the liver, and these herbs also go through that same pathway. And that can cause a bit of a traffic jam, if you will, and change the metabolism or the breakdown of both the drug and the herb, which can make a drug either maybe more potent or powerful or less potent or powerful. And so those are the sorts of things that we need to be careful with. And so it's mostly about drug interactions, and people should talk to their doctor, talk to their pharmacist, or get a naturopathic doctor on their team who knows about this sort of stuff if they're on drugs and they want to add some of these compounds in.
Thank you for sharing that.
You're welcome.
Very important disclaimer. I'm just curious, are you taking new patients right now? Should have asked you that. No. Okay.
I'm not personally. Yeah. I'm at a point in my career where I just can't. I'm not personally. My office is, there's a bunch of other doctors in my office that we're all cut from the same cloth. And so there are new patient appointments available, but just not with me at this point in my career. And I'm proud, but also sad to say that. Yeah.
We're proud of you too, but our audience just went, oh.
Well, you're educating a lot of people. I think that is a very important role to play as well. So
thanks. Yeah. That's been a big transition, right? Is like taking the advice and the guidance that I've given to patients over so many years and trying to translate that into, out there into the world at a different scale outside of the walls of my office. And that's kind of the career path that I'm on right now. And that's been great and productive as well. Very different, but wonderful.
Yeah. Amazing. Well, this has been such a fun conversation. We could talk to you all day, but we want to respect your time. We would love to close with one final piece of advice, something you could share with our audience that they could start doing like right here today to optimize their health.
I love it. Yeah, let's do it. So I mentioned, and I teased a little bit about IL6. It was a cytokine. It's an inflammatory
I forgot.
cytokine.
We're going to circle
Yeah.
back.
So we're circling back, but you led me right there, right? So it's perfect. IL6 is an inflammatory cytokine, and there was some research that came out of the University of California at Berkeley a few years ago. That's maybe one of my favorite all-time research papers. And what it showed, well, let me put it this way. It's long been known that positive emotions are correlated with good health and negative emotions are correlated with bad health, right? So anger, envy, jealousy, sadness, those are correlated with bad, poor health outcomes. And positive emotions, things like happiness and love and contentment and joy, those are associated with positive health outcomes. So the question in this study was, which of the positive emotions is most strongly correlated with reduced levels of inflammation? Which of the positive emotions is the most anti-inflammatory? And it turns out that the answer, by looking at IL6 levels, is awe, A-W-E, awe. Finding awe out there in the world, right? Technology, nature, your children, your family, whatever it is, your food, you slice open an orange and you go, wow, it's so beautiful. It's just awesome the way it's segmented like that. Finding awe, and people who find awe more regularly have lower levels of IL6 and lower levels of corresponding inflammation. So you asked me for a tip or advice, just go find something awesome. Go out there in your world, in your house, in your backyard, within your pet, in your family, and find something awesome and just lean into that. And that is my number one tip right there.
Oh, this is crazy. Just yesterday, I put a book called Awe in my Amazon cart, and now I gotta get it.
Yeah.
What's the
you
book?
should have bought it. Yeah.
Well, it's in the
Prime
cart.
Day.
I should. I gotta hit send. I gotta hit confirm. I put it. I will tell you later who the author is, but I put it in. I'm a microdosing coach, and so people were talking about it in my cohort about supporting inflammation through exactly what you just said.
Love it.
I haven't read the book yet, but I'll report back.
All right.
Great.
Well, this has been awesome.
Hey, we just did it. I can feel my inflammation going down right now.
Yeah.
Yes. Yeah. I'm actually, sometimes I feel guilty of using the words awesome and amazing too much, but I'm just going to go with it.
Yeah. Lean in.
Yeah. Lean in.
That's awesome.
Yeah. All right. Well, Dr. Josh, thank you so much for spending your time with us. This has been so much fun and educational too. So thank you. Thank you.
I'm so glad. Thank you for having me.
Can you tell our audience where they can find more of you?
Sure. Yeah. I am a co-founder and the medical director at a company called Up Wellness, which is where most of my time is these days. And that's at upwellness.com. Pretty straightforward. And then I'm also doing a lot on social media these days. So I'm at Dr. Josh Levitt on Instagram and on TikTok of all places. I never would have thought I was going to be doing that when I was in medical school. And on the new Meta product Threads, I'm over there too. So at Dr. Josh Levitt on any of the social media platforms. And I'd love to see you and interact with you there.
Perfect.
Great.
All right. Well, thank you so much for joining us today. This is, can't say it enough. It was awesome. Thank you for your time.
Thank you.
And thanks to everyone for tuning in. We'll see you next time.